Hi, my name is Jayla Harrison, and this is my presentation over head and neck disorders. So my presentation is over tonsillitis, a very common disorder that a lot of us get. So tonsillitis is the inflammation of the palatine tonsils, which are lymphoid structures located in the oral pharynx. It can be caused by viral or bacterial infections that commonly affect children and young adults. Symptoms include sore throat, fever, difficulty swallowing, and enlarged lymph nodes. So the anatomy, the palatine tonsils are located within the lateral walls of the oropharynx in the shallow recess known as the tonsillar bed. They are bordered anteriorly by the palatoglossal arch and posteriorly by the palatopharyngeal arch, forming the lateral portion of the Walder's ring. Sensory innervation is primarily provided by the glossopharyngeal cranial nerve, while blood supply comes from branches of the facial artery and lymphatic drainage flows to the jugulogastric cervical lymph nodes. And here I posted a picture of, so you see in the middle, that's the uvea, the palatopharyngeal, which is here on the right, and the palatine tonsils, as we all are commonly aware of, is the tonsils here in the back of our throats. The pathophysiology. Tonsillitis occurs when viruses or bacteria infects the tonsils, causing the immune system to respond. This response leads to inflammation, which makes the tonsils swollen, red, and painful. As the tonsils enlarge, swallowing becomes more difficult and nearby lymph nodes become more swollen. So, like a fun fact for everyone to know is the tonsils is like a first line of defense for our bodies. It has like this mucus barrier that tries to keep away any irregular pathogens that's viral and bacterial. So we wouldn't get this disease, but sometimes pathogens are able to enter into the protective mucus layer that we have back there, and that's why we receive, tonsillitis. I will tell you guys more about it. So, bacterial tonsillitis is caused by Streptococcus pyogenes, which is the bacteria. It penetrates the protective mucus layer within the oral and nasal cavity. And viral tonsillitis is caused by multiple viruses. So we have bacterial tonsillitis and viral tonsillitis. There is a difference. So viral tonsillitis is usually caused by rhinovirus, influenza, rubella virus, and many more. And I will tell you how we will treat these on the next slide, I believe. Yes. So for the diagnosis, tonsillitis is diagnosed through clinical examination. So if you just go to your regular primary care physician or to your local CVS or your Walgreens, you will be able to get diagnosed if you're just having like a sore throat, whenever. So they'll go by your patient history. So if you just have like a history of sore throats or tonsillitis, they will go based off of that, but they'll also do a physical examination using a swab. It'll look like a cotton swab for your ear, but it's like really long. I'm sure you guys seen it through COVID. So yeah, they'll do a physical examination using a swab for your throat. They'll examine your ear and your nose and check if you have a fever. Those are also indications that you may have tonsillitis, that you may have detected this bacteria. They'll also do a rapid strep detection test, which is with the cotton swab, the enlarged cotton swab. They'll swab your throat, both sides, left and right, to see if you have contracted this virus, and they'll take the culture and run it through the test, and if it comes back positive, you have tonsillitis. Treatment and prognosis. Tonsillitis is treated based on the cause. Viral tonsillitis is managed with rest, fluids, and pain relievers, while bacterial tonsillitis is treated with antibiotics such as penicillin, amoxicillin, and these can be given liquid form or pill form. In severe or recurrent cases, removal of the tonsils may be recommended. The prognosis is excellent, with most patients recovering within fully to 7 to 10 days. So, for my comments, in conclusion, tonsillitis is a common condition that affects the tonsils and is usually caused by viral or bacterial infections. With proper diagnosis and appropriate treatment, most individuals recover quickly and without complications, making the overall outlook for tonsillitis very favorable. And I have a fun fact for all you guys. So, tonsillitis is commonly known for young individuals. And I don't know if you ever noticed, like if you have children or not, it is a very common like condition. If you send your kids to school and they may come back saying that their throat hurts, it's probably because that those kids have contracted the bacteria streptococcus. So just be aware of that, you guys, and take precautions, wear your mask, and also wash your hands. That is very important. I know that we've always said do that during COVID, but you'll never like understand when you touch a doorknob, somebody could be sick and touch the doorknob. So just be aware of that. And I wanted to show all you guys my references. I have 4 of them. And I hope everyone just enjoyed my presentation. And again, my name is Jayla Harrison, and I hope to hear great feedback from all of you guys. Thank you very much.